Evet, herkese merhaba.
Good afternoon, everyone.
Umarım çok fazla rehavet çöktürmeden iki konuşma yapacağız.
After the lunch, we will have the session in which there will be two speakers. The next session was very nice, actually. There were too many questions. It ended late. That is why we wanted to give you some time to eat your lunch. From Ankara University Faculty of Medicine, Cardiology, my co-chair is here. And I would like to also thank the ARİS Pharmaceutical company for supporting the Congress. We will be speaking about L-arginine and its effect in cardiology, in other fields, as well as sexual dysfunctions. We will be speaking about the somatic, cardiological, and effects on sexual dysfunction. And we will also have time for Q&A. As Professor Ali mentioned, there's a question mark here, and if the answer was no, we wouldn't be making this presentation here. We are here because we think it works. And what do we see in terms of sexual dysfunctions? I mean, I will give you a general outline, then start focusing specifically on what can be done, what is our approach to sexual dysfunctions, and other than sexual therapies, are there any other tools that are available for us? Impotence and frigidity, these aren't used anymore in today's conditions. We look at the sexual physiology, looking at the responses, and if the anatomical structures are okay, and if the other factors are okay, then we do not expect a decrease in sexual desire. And secondly, together with vasocongestion, we see increase in blood buildup in the sexual organ, which results in erection for males and lubrication for females. But if there is a dysfunction related to stimulation, then we see these syndromes. And the third phase is orgasm. We have the ejaculation for males and muscle contractions for females. It is more a subjective experience of the orgasm. And for males, we commonly see premature ejaculation. It is the most frequently encountered sexual dysfunction. And orgasm dysfunction is unable to achieve orgasm is the frequent problem in females. So sexual desire for androgens take the main role here, and males have in average more sexual desire than females in general. And the testosterone sensitivity is also a bit higher, and they can also, as you can see in the example, show sexual desire to a municipality, like in this joke that is shown here. The testosterone is the most important factor that also determines social status. So it is not only related to increase in sexual desire, but also shows other males that he owns the place. This place is his. So in social hierarchy, he has a better approach on the clues, whether there's a competition there in the social environment, and if the social hierarchy, his status deteriorates, it may result in a decrease in sexual desire too. So it is not like a pill that you can give to increase sexual desire. Although in males it is a bit higher, for females, of course, it is a bit lower, and both genders approach one another, and they look for potential partners, and they show their preferences for partners, and the sexual motivation is also there. When some men have problems with their partners, they may still want sexual intercourse, but if females have a problem, emotional problem or relationship problem, there may be a decrease in their sexual desire. We see here estrogen, prolactin, oxytocin, which are effective, and also there is an inhibition as well. And here, for stimulation, inhibition is very important, and maybe you would remember this TV series. It is the bad female who starts the intercourse and takes pleasure in the sexual intercourse. So there is such a pressure on women. Of course, this results in a pressure on sexual desire as well. The sexual desire is suppressed, and that is hard to express the sexual desire because there is a room for misunderstanding as well. If we're speaking about a heterosexual relationship, if the woman takes pleasure and tries something new, then the partner may be disturbed thinking about where she learned all those. But on the other hand, if the woman doesn't, female doesn't respond a lot, then the male will complain again about the lack of response from the woman. And for females, we have a decrease in sexual desire and stimulation dysfunctions. These are the most frequently experienced sexual dysfunctions in women. Low self-confidence, anger, and depression, as well as tiredness, and also for depression and anxiety. When you give the treatment, it may result in a decrease in sexual desire. Lack of sexual desire triggers depression, and the treatment of depression may result in decrease in sexual desire. So sexual therapies may be an alternative, but it's not possible to use them on every patient. Sexual therapies are not 100% effective, like in the case of vaginismus. They may be less effective on some cases. And there is a book by Nancy Friday. I read it in English actually. There's a Turkish translation as well. It is My Secret Garden, the name of the book. It tells about the sexual fantasies of females, and we recommend this book. Why? Because of these sexual inhibitions, the fantasy world of the patient may be very limited, and they may not know what stimulates them or what gives them pleasure. But there are lots of fantasies in the book which may give them an idea about what they are stimulated with, and they may not want to speak about these fantasies or other things during the therapies, so we do not ask them a lot and do not force them to share them. So maybe it's not ethically, morally acceptable, but still these things may come to their mind. So this is what we want them to know by reading this book that we recommend them. For example, I had two female patients who came to me, and after reading this book and talking about it, I saw them feeling better. So this was important for their treatment. And if there's a reproductive dysfunction, which is the result of lack of sexual desire of the women, we do not have too many options. We, for example, have Argin Max. It's used for women. There is a study from 2006 which was published in premenopausal women. The frequency of sexual intercourse and pleasure from sexual life is increasing. In the postmenopausal period, sexual desire is increasing, and in the perimenopausal period, the frequency of sexual intercourse is increasing with its use. So for younger patients, the results, the consequences are really destructive. Therefore, this is important to use it. Argio women, it also increases sexual desire, and Panax, Korean ginseng, and ginkgo biloba, and here this broom that the woman is holding in her hands is not for warning the neighbors living upstairs, but it is for using it for themselves, the flavonoids, we can say. We do not have too many options for female sexual dysfunctions, and not every one of them have access to therapy. Therefore, food supplements and medication may be useful. And the sexual response cycle for women, you can see here there is stimulation, excitement, then a plateau, and resolution. So women can have multiple orgasms if the stimulation or excitement continues, or they may have an stimulation and directly resulting in orgasm. But for males, it is not the case. For the sexual desire, for the excitement to come back and for the erection to come back, there's a need for some time. Not everyone accepts this, but it is the case. During teenage years, adolescence, the sexual desire may come back in a very short period of time, and the sexual intercourse, they say, can continue multiple times, but I do not believe in this. And with aging, this sexual desire may take longer to come back. And it may be considered as a problem of erection, but it is about premature ejaculation actually. As the time period between the two sexual intercourses gets longer, then it may appear to be an erection problem, but it is not the case. We should have a look at the erection physiology to have more information on this. Norepinephrine actually, when there's a more excitement, it is not related to erection. The non-cholinergic fibers are responsible for the erection, and the nitric oxide release is triggered by them, and it works for erection. It supports the erection. However, nitric oxide has a very short half-life, and therefore it is destroyed very fast, and the cyclic MP is being released within the cell, within the smooth muscles inside the vessel, and as the cyclic GMP stays longer there, the erection will last longer, and the corpus cavernosum starts filling with blood, and in the dorsal of the penis, the vein is the blood is stuck there, and then there is ejaculation, and then the nitric oxide release is cut suddenly, and as the nitric oxide disappears, there will be the phase of relaxation where the blood circulation will start again, and there will be a venous escape. In sexual therapies, I received my training from CHETAT, the Sexual Education Treatment and Research Association. I recommend you to do this as well. The sexual therapies start with behavioral cognitive therapies. We give them homeworks, start with behavioral homeworks, and inform the patients at every stage. But we know that some patients may not be fit for therapy. They may not want it, they may not bring their partners, and in these types of patients, we can try medical therapies, but we should inform them very well. Accurate information is important, and these are the things that a self-claimed sexual therapist says. These are published in the newspaper, but these aren't accurate. Accurate information is important. First, inform the patient about a physiology of erection. First of all, the nitric oxide. it is important, the release of nitric oxide. If there's a sexual stimulation, then there will be erection. Nitric oxide, cyclic GMP, and PD5 inhibitors, which prevent its destruction, and the refractory period also, you need to inform them about this. Everyone knows about it, but they act as if it doesn't exist, but it is not the case. And with age, with aging, the refractory period prolongs. And lifestyle is important. We tell patients to quit smoking, but they do not want to do it. But if there's an erection problem and we tell them to stop smoking, they have a better motivation to do it. And walking is very important, 30 minutes per day. We want our patients to exert themselves a little. I mean, we tell them that when they're singing their favorite song, they should have difficulty singing it as they walk. So not too fast or not too slow. The accurate speed is important. And the Mediterranean diet is important. We tell them to use it. And about medical therapy, we tell them how it works. It's not like take the medicine and you will have an erection. They should have lower expectations. When you give a medicine effective on PD5 or release is induced by it, then the erection will not be at the level when they have during adolescence. And they should also stop making love for the purpose of intercourse. So intercourse is just a part of this. So when they have an erection, they may want to have intercourse in just 1-2 minutes and maybe to rush it a lot, but they shouldn't do this. And when there's erectile dysfunction, the foreplay should be longer, and the PD5 inhibitors may not be involved if the foreplay isn't long enough. And when you use PD5 inhibitors and try it in a sexual intercourse that you pay for, you may not get the erection you want. And the NOC-GMP boosters, the use of spontaneous PDE5 may affect spontaneity. And here we may recommend tadalafil 5 milligrams per day, so it will not have an impact on the spontaneous nature. And the PDE5 inhibitors, their use actually is a source of problem. Many of the patients discontinue it. Sometimes they don't have the chance to use it, or they say there is a loss of spontaneous nature behavior. And the L-arginine, for example, can it be useful? There is a study about this. And the central bank was about to announce its decision for the interests. If we have another peak in dollar, in the foreign currency, dollar currency, then we may have difficulty importing it because it was already expensive. So do we have an increase, a rise in currency, in the dollar? I think it will be announced tomorrow, so we still have time until tomorrow. L-arginine is found to be effective in regular use, but L-arginine preparations should be used 3 times a day. And the nitric oxide is released more throughout the whole body, starting from the venous structure. If there's a venous structure problem, then erection may not be very good. If the endothelium of the vessel is healthy, then the erection is healthy. Mr. Sadi will probably speak about this as well. Older than 40 years of age and erection problems, in the next 5 years there will be a higher chance of cardiovascular or metabolic problems. That is why we want a consultation from cardiology as well. And if there's a heavy dysfunction, severe dysfunction, its effect will be limited. So the problem we have is that when we have a new product on the market, we try to use it in the most severe cases, but we may have better outcomes in easier cases who do not have access to therapies, may be unable to afford it. It may be an option. When used with PDE5, it is safe, and if you're not using another vasodilator agent, there won't be any problems. And ginseng, do you think it may increase nitric oxide? We don't have sufficient data. It generally functions through the L-arginine. And about serotonin reuptake inhibitor, there may be problems. And the ginkgo biloba has debatable outcomes on this. I don't think there's a study related directly to L-arginine about this. And for females, increase in nitric oxide will not be enough. Testosterone boost may be necessary, and Damiana probably gives the support. So maybe these aren't effective one by one, but may have a synergic effect, which may result in better outcomes. So in depression, due to the treatments that we give, also there may be a decrease in sexual desire, and with treatment we don't have a full recovery, and with SSRI in orgasm and stimulation, there 40 to 60% there won't be a very good improvement. And for males, we have the rate at 42%, therefore maybe some herbal therapies may be considered as well. Sexual consultancy is important, working on the myths, talking about them, informing the patient, and trying to work out a solution. You don't have to give therapies to everyone. You can use the right language, right discourse, and give them information. And this may sometimes solve the problems to a great extent. And sports is important, exercise is important, particularly for women. There is an improvement independent from the level of physical exercise. It is also the case for men, but for women, there's an improvement in terms of desire, stimulation, and orgasm. And dietary recommendations are there. We recommend Mediterranean diet and other supplements to increase the levels of nitric oxide. And supervision here auditing is actually lacking here. We really need to know what the herbal products include. It may be approved by the Ministry of Agriculture, but we may not know its contents exactly, which may result in some problems. However, RGO Women has approved herbal content, but although they are herbal, they may still result in drug interaction problems. And if the individual does not want PDE5 inhibitors, does not want medicines, or does not want therapy, and if there is a light to moderate erectile dysfunction, this may work for regular use, particularly until towards the end of the first month. It will become effective, like tadalafil 5 milligrams. You have the effect in a course of 1 month, and it affects the vascular health positively, also including the vessels of the brain. But for women, females, we don't have too many tools that we can use. You cannot give just one medicine and expect everything to be cured. But if there is no access to therapy, and if the motivation is high, then you can try using it. Thank you very much for listening. I'm ready for your questions and comments.
Efendim hepinize saygı ve selam.
Good afternoon. This was a really interesting presentation, And as a person who is far from the area, I really benefited it. And I'm a cardiologist in the Psychiatry Congress, and this is something interesting and new for me too. We had the chance to meet online, but this is the first time I'm physically attending. And generally, when I start, I always think how I should start, and I have a belief that if I can start impressively, then I will have more attention. And there was my daughter next to me, and I asked her, how should I start? And she told me that, tell them about your childhood. Maybe because of all the series that she watched. But my name is Sadi. But I was not happy with my name when I was a child, because none of my friends were called Sadi. They were called different names such as Ömer, Ali, Can, etc. And I was the only person that is called Sadi. And I was in the 4th grade in elementary school, and I approached a little girl and I told her that I like her, and she told me that she likes me, but your name is really ugly. And then she started dating another boy called Ercüment. And in the secondary school, and of course, there were the rhymes. There was a topic of rhymes, and I will tell the name of one of your friends, and you will make a rhyme with it. And my friends started using the name, and they called me, but one of my friends found a rhyme that really was mean. And in high school, despite my name, I made a friend. I had a girlfriend, and she told me that let's go to a fortune teller. Let's go to her. And of course, I said, okay, let's go. But I can sit there, you can go there, and I will wait for you. So we went to the fortune teller, and she looked her palm and told a couple of things, and then my girlfriend pointed at me and asked about our relationship, and then the fortune teller gives her a paper with letters on it, and she asked her to cut the letters of my name, and she put the letters into this cup, and all these letters started to float, and in the end the word AIDS came up with the letters of my name. So this relationship did not last for long. So L-arginine, sexual dysfunction, were actually discussed by Çağdaş, and I will be talking about the cardiac part, its relation with the heart. And in 2017, I had a phone call. Professor Şesvar Ertürk called me and told me that I would like to have you as a speaker on hypertension. And he told me that this topic is just the right one for you, because it's sexual dysfunction and hypertension. So I said, why is it just for me? Why did you say that? I asked. And then I talked to the organizing committee, and I was told that he typed my name on the internet and found your name, they said. And when you type Sadi Güleç on the internet, on Google, you can see these photos, and I looked at them and tried to find out whether I look really sexy or not. But then after every photo of me, there is a photo of a couple in the bed. And then I I understood that I made a speech about the sexual life of the cardiac patients, and then some newspapers came to me and they made some reports about this topic. And you can see my photo in a very small size, but there are larger photos that show couples in bed. So this is why I believe they chose me. And in that Congress, I was asked to speak about the sexual relation, and I changed this phrase with washing. And I told them that I cannot keep saying sexual relation, so it was about washing. So they come to me and say that I'm a cardiac patient, can I do the washing? And I tell them that if you can climb up the stairs up to 2 or 3 floors, then you can wash the dish, you can do the washing with your spouse.
Efendim uydu sempozyumlar birazcık da böyle
Of course, we have the satellite symposium that will actually amuse you. But I need to go back to the heart. Sometimes people ask, how can the heart be diseased? But it's actually in the word itself, because if you turn it round, you will see the word plaque. And because of this plaque and with some stenosis there, you will have the problem. So when we look at the atherosclerosis, you see that the vein looks like a highway, and there are endothelial cells on the sides of it, and these are really important because they act as a barrier, and they are anti-inflammatory, anti-thrombogenic, and they have other characteristics. But when they are exposed to risk factors, and we start very well at the beginning when we are born, and then we start smoking, and there's diabetes, dyslipidemia, etc., and the atherosclerosis develop, and once there is a thrombus here, then you may have a heart attack, and 1/4 of those patients lose their lives at the moment of the attack. So therefore, the vein path, the arterial path should be healthy, and these here we mean by this the endothelial cells, and we need nitric oxide for this because it protects the endothelial veins, cells and veins, and nitric oxide is something that is good for every problem, because it prevents the thrombus and inflammation and vasopression, and it causes some healthy vasorelaxation. Therefore, if we can increase the level of nitric oxide, then we can correct the blood pressure, we can have anti-ischemic effect and anti-atherosclerotic effect, and we can have collateral improvement. So, it is a heart-friendly agent. And L-arginine is actually a precursor of the nitric oxide. L-arginine is converted into nitric oxide through nitric oxide synthase. So what is the source of it? We have the protein metabolism, and it can be in the body endogenously, but sometimes you can also consume some food to get it from the outside. And it is kind of half essential amino acid. I mean, it's produced in the body, and sometimes you need to take it from outside. Therefore, for healthy endothelial structures, you need arginine, just like you need nitric oxide. I eat meat, you may say, and I get enough L-arginine, but despite you have L-arginine at a normal level, there could be some functional problems or dysfunctions. We have ADMA, the asymmetric dimethyl arginine in the blood, and in order to use this enzyme, NOS enzyme, there is a competition between L-arginine and NOS. Let me explain this. We have NOS, and this creates nitric oxide, and it protects the endothelial system and cardiovascular system. Let's say that we have 6 L-arginine and 6 nitric oxide synthase, then it creates 6 nitric oxides. But if we have ADMA, then it will use a part of the NOS we have. And when it's used by ADMA, it will just prevent the creation of nitric oxide. Therefore, you have 6 arginine but 3 NOS. Therefore, you can only create 3 nitric oxides. So you will produce less nitric oxide and you will have less cardiovascular protection. Therefore, high level of ADMA is actually frustrating for us. Therefore, it's not enough to have a sufficient level of L-arginine. When there is high level of ADMA, it will be a risk factor for some diseases, which are also risk factors for erectile dysfunction and cardiac diseases. And of course, not only L-arginine, but also L-arginine ADMA ratio should be focused on, because their ratio is very important in terms of the level of nitric oxide produced. In 2000s, I started to be interested in nitric oxide because there was a study we conducted, and for some genetic reasons, some people produce more nitric oxide, and we looked at these people and try to find out whether they have better collateral development when the heart needs it, and we saw that it is distinctively better, and you will have more nitric oxide because of the NOS you have. And okay, we like the this vasodilatation, but we don't want it too much, because if you dilate it further, it will look like this. And we don't like the stenosis, but we don't like the dilatation either, because this may cause some problems and it may lead to heart attack. Therefore, if the nitric oxide is more than necessary, then it may cause some pathologies, we thought, and this is why we conducted this study. And maybe because of the genetic reasons I mentioned, overproduction of nitric oxide may cause some problems, we thought. But in this study, we saw that they don't cause such problems, so we were relieved. And I always talk about nitric oxide, but there is also the L-arginine. I mean, is there a correlation between L-arginine use and the collateral development? And ADMA levels and L-arginine levels were studied in this trial, and they saw that the higher the L-arginine level is, the better the collateral veins are. Therefore, this finding also supports our hypothesis. So as a hypothesis, we can say that the L-arginine supplement will increase the NO level, and it will have a good effect on the cardiovascular system. But always we should support these arguments with scientific data. So we had this trial, and we looked at different trials, and we made a meta-analysis about this from some popular journals, and we tried to find out the L-arginine effect on the blood pressure. And the average blood pressure is reduced by 2-3 millimeter mercury, or around 5 millimeter mercury. But if you can reduce the blood pressure of your patient by 2 or 3 millimeters mercury, and if you can sustain it for a couple of years, then you will reduce the cardiac death by 7%. So this is an important figure. And it also affects the lipid levels, not too much, but it reduces the blood triglyceride level. We like it too. It has an antithrombotic effect. With the hypocholesterolemia, endothelial structure is harmed, and they gave vitamin D and L-arginine, and they had some positive results. And endothelial function can be typed in PubMed and with arginine, and there are more than 15,000 trials about it. And if the endothelial function is impaired, if you give L-arginine with some other supplements, it will be improved. So I will not go into details, but we can understand here, if you give L-arginine supplement, you can increase the nitric oxide synthesis, and you can correct endothelial function, reduce the blood pressure, improve the collateral development, and you can reduce the thrombosis. So we saw all this from the hypothesis and from scientific data. Of course, the drugs go through very strict reviews, but the supplements do not. Therefore, they can be good, they can have some good effects, but we should not be doing harm. And I went through the literature, and up to 9 grams, I found that they have some side effects only on the gastrointestinal system. And it is said that up to 20 grams per day, you can use it safely, and we don't even give such high doses. It's around 2-3 grams. And can we see any case reports about the cardiovascular effect of it? No, we can't. I couldn't find any studies that shows us case reports about this, although we have these supplements for a very long while. There wasn't a clear case report about this. And this is my final slide. I will ask you a stupid question. I will tell you names of men. And which one of those is the one who cares more about his endothelial structure? Is it Erol? Ertan? Or we have Dr. Tarkan? Or Nuri? Or Nail Ergin? Who votes for Erol? Please raise your hands. Ertan, who votes for Ertan? Please raise your hands. 2. Dr. Tarkan? Nuri? But Nail? I went to a fortune teller, you remember that. Do you know who Erol Soltek is? That is cholesterol. So cholesterol is not good for the endothelial. Ertan? This actually turns into hypertension. I was up all night to prepare this slide. And then we have Dr. Tarkan Hobi. What is this? This is carbohydrate. Carbohydrate actually makes us happy, but not as much as endothelium. Therefore, we have to eliminate it, although it was a doctor's name. Nuri? These are tobacco products. and they are not good for endothelial. Therefore, the answer is L-arginine because it is L-arginine. L-arginine is good for your endothelium. Thank you very much for your attention.
Çok eğlenceli bir sunumdu.
A very fun presentation, thank you. We didn't know cardiologists could make such funny presentations, so it was a surprise to all of us and really enjoyable. Now the floor is open for questions and comments. Any questions or contributions? Mr. Nail put it very nice. I'm sorry, it is not Nail actually, it is Sadi. Sorry. Mr. Sadi told everything very clearly then. I guess no questions and no contributions as far as I can see. Thank you very much for your participation. I would also like to thank Mr. Sadi for coming all the way here. Good afternoon.